Welcome back. In this video, I'll talk about arrhythmogenic right ventricular dysplasia. This condition is the second most common cause of sudden cardiac death, and it results by fibrofatty replacement of the right ventricular muscles. In the ECG, you will see the characteristic epsilon wave, T-wave inversion, some localized widening of the QRS complexes, and ventricular tachycardia. It is caused by a mutation specifically affecting the desmosomal proteins. These proteins connect the heart muscles together, and they are important for the integrity of the heart wall. There are still some debates about the exact cause and the inheritance of this condition. The patients will complain of shortness of breath, especially when they're lying supine, some dizziness and sometimes syncope, heart palpitation, chest pain, and swelling in the legs. They can also have some persistent cough that does not resolve with the normal treatment of cough. For these patients, we do need to implant a cardioverter to prevent arrhythmias and sudden cardiac death. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert, so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.